Thank you, Amy. Appreciate the introduction, and I want to welcome everyone joining today for our presentation, Understanding Data and How to Make It Actionable, particularly around compliance and internal audit, and focus on the revenue cycle. I won't take the thunder from the presenters as they talk about the topic, but again, I appreciate everyone's attendance. It's hard to believe we are mid-November and only a few weeks or less from Thanksgiving and other holidays, so the year has gone by quickly. Likewise, we are also wrapping up our fall webinar series that's focused this year on health systems and internal audit and compliance in particular, although I think a lot of the topics we have presented on have operational implications outside of these particular operational areas. And again, I appreciate your attendance. One point I would like to make, though, since this is the last of the four-part, we'll most certainly be doing this again next year. And we've done this several years now. And any in your feedback forms, if you have any thoughts on other topics you'd like to hear about, or if there's a deeper dive you'd like to do on any of these topics, please provide that in the feedback, because that helps us put together a session that's more pointed and focused on your particular needs. Quick introduction on myself. I'm a partner in Minneapolis, and I head up the health system segment. I'm on the assurance and audit side, and I also have a role in leading the internal audit practice. I am going to be passing it over now, though, to people that are really more experts in the revenue cycle area. And particularly, I'm going to pass it over to Amy Tepp to introduce the topic and presenters. Amy is also a partner in Minneapolis and heads up our revenue cycle practice. Amy comes to us from several different stops in her career, including with some large health systems and working in revenue related areas. So with that, I'm going to kick it over to Amy and let you take it away.
All right, well, thanks, Scott. And yes, I'm sitting here. Rochelle will be stepping in a minute. We're sharing an office today. So I'm happy to be here today and introduce not only Rochelle Damon and Nicole Nail from our team, but also about this topic. And I think what I want to emphasize is you're going to hear initially from Rochelle, who'll be starting this off, kind of giving you just the basics and terminology to understand what are we talking about, what data, how to make it from being just a bunch of data into something that's easy to understand and utilize. And then we'll have Nicole do a case study, so you'll have something practical to kind of look at, and then they'll kind of round it out at the end with just a little bit more of like, now what? Now what do we do? So I just want to give you a little bit more background on the two presenters. Rochelle Damon is a senior manager in our revenue cycle practice. And the unique thing about Rochelle is that she actually has an information systems background, but she also has a revenue cycle background. And if you talk about data and data analytics with her, that's her passion. So it's been very fun to see her kind of work through some of these things and help us with understanding it and how to use it in practice. She has over 20 years of experience in revenue cycle and pricing. And now I'll also introduce Nicole Nail. Nicole has over 11 years of experience. The unique thing about Nicole is she actually participated in our firm's data analytics exchange program recently. Was able to do some things through that exchange program to help in this data analytics area for the revenue cycle. So that's been very exciting for her and for us in the revenue cycle group. And it's been nice to have somebody that actually, works within the revenue cycle to help develop some of these ways of analyzing the data. And with that, I'm going to turn it over to Rochelle.
All right, thank you, Amy. Sorry, we had to play some quick musical chairs there because we're sharing an office at the moment. And I am going to share my screen here, so just hold on for 1 second while I switch. So like Amy said, I'm going to start by going through the definitions of big data and then going through what we kind of currently think of as analytics and data to where we may be, to where we want to be in the future. And then kind of what is all of this data analytics talk and how does it actually relate to healthcare and what we do in day-to-day practice. I think a lot of times we go through all this information, but we really don't know how to relate it to what we actually do. And then just some information on analytics around accounting and finance and where the industry is going in the future. And then Nicole's going to hop into a case study and show you some real world examples. So defining big data. I have this slide in here because you can see the variation of definitions for big data. Big data is kind of like this anomalous term that's out there that really doesn't have a set definition. It kind of really depends on who you're talking to and in the context of it. So in the sense from the actual Oxford Dictionary, it's a noun, extremely large data sets that may be analyzed computationally to reveal patterns, trends, associations, especially relating to human behavior and interactions. So that is our standard dictionary definition. According to SAS, big data is a term that describes a large volume of data, both structured and unstructured, and we're going to get into the details surrounding that today. Includes a business on day-to-day basis. It's not the amount of data that's important. We really want organizations to understand, yes, we have volumes and volumes of data, but the volumes aren't as important as the actual data itself, and looking at what we really need to look at versus trying to weed through everything and pick out things. So that's the whole concept of data analytics. And then also big data in health encompasses high volume, high diversity, biological, clinical, environmental, and lifestyle information collected from single individuals to large health systems in relation to their health and wellness status. Also billing information, collections information. So there's so much data out there. We can really drown in this easily. So we're going to help you kind of pinpoint where you need to be and what you really need to look at through all of this. So big data in healthcare and just big data in general have 5 dimensions, and I'm going to point these specifically to how it relates to actual healthcare. So first off, we have volume. As we all know, there's so much data out there, and it can be associated with many things. You know, we have lab tests, we have physician visits, we have administrative data around our payers and our payments. So we have all of this information floating around out there. We also have a variety of data, can be in different formats. We have structured data, which is actually like databases, structured delimited files. We have markup files like in pharmacy, or we have unstructured data with PDFs, images. You know, we may have radiological images. We have video, audio, text. The huge diversity of data types that healthcare organizations see every day is just mind-blowing. Again, think about electronic health records and those medical devices. Each one collects different kinds of data, which in turn might be interpreted differently by different physicians or made available to a specialist, but not a primary care provider. And so what we want to do, one of the challenges in healthcare when it comes to the data variety, is we want to make sure we're standardizing it and distributing all of that information so everyone involved in the care of the patient or the financial health of the organization is on the same page. So with increasing adoption too of population health, big data analytics, we're seeing a greater variety of data by combining traditional clinical and administrative data with unstructured notes, socioeconomic data, and even social media data to really drive the care for our patients, determine the need for patients and whatnot. So it's a really cool time to be living in healthcare. Also, one of the 5 dimensions of big data is value. So we must have data that's actually valuable. There's a lot of garbage out there because there's a lot of information, and you just really want to hone in on that information that actually provides value for what your goals are. So that is, if you're going to invest in the infrastructure required to collect and interpret all this data on a system-wide scale, it's really important to ensure that the insights are generated based on accurate data and lead to measurable improvements at the end of the day. So that's really something to think about. Again, we can get buried in all the information. We just really want to make sure we're focusing on those things that are valuable to help us achieve our goals. Also, one of the 5 V's or 5 dimensions, I like to call it the 5 V's, but you also hear 5 dimensions. Velocity. The data is real time, streaming. As we all know, we can watch TV on demand these days. We can do so many things with the data right at our fingertips, including our phones. So velocity in the context of big data refers to 2 related concepts familiar to anyone in healthcare. The rapidly increasing speed at which new data is being created by technological advances. Think about like IV pumps. I mean, they're all computerized now. And the corresponding need for that data to be digested and analyzed pretty much near real time to help with clinical decision making. For example, more and more medical devices are designed to monitor patients and collect data. Think about our watches that we wear nowadays. You know, they're telling us our heart rate, our O2 sats, and everything now. There's great demand to be able to analyze that data and then transmit it back to clinicians and others to help drive the care of our patient. This Internet of Things of healthcare will only lead to increasing velocity of big data in healthcare. So, you know, this is just kind of the tip of the iceberg. It's just we're gonna get more and more information as technology advances over time. And the last of the 5 V's is variability. The way care is provided to any given patient depends on so many different factors, and the way the care is delivered, and more importantly, the way the data is captured may vary from time to time or place to place. You know, there isn't a set structure for this. There isn't a set way of gathering this information and storing it. So for example, what a clinician reads in the medical literature where they're trained, or the professional opinion of a colleague down the hall, or how the patient expresses herself or himself during an initial evaluation, all may play a role in what happens next with this patient's care. Such variability means that data can only be meaningful interpreted when the care setting and delivery process is taken into context. For example, a diagnosis of CP may mean chest pain when entered by a cardiologist or a primary care physician, but may mean cerebral palsy when entered by a neurologist or a pediatrician. So we really have to make sure that we understand the constants, we understand what some of these variables may be. So when we're digesting the data, we're truly understanding what it is telling us. And I know this sounds really overwhelming right now. So I'm going to go through the data analytics pipeline. This is what we would consider traditional. Oh, we have a polling question. Amy, should I just keep rolling? Sorry.
Yes, please.
Okay, thanks. So traditional healthcare business intelligence, this picture is what we would generally think of as how we would get our information. I know when I first started in healthcare many years ago, if I needed anything in a report, I had to submit a request to IT. IT didn't necessarily understand what I was asking for. They would try and get me the information to the best of their ability, but they weren't really the experts. And so they could only really get me what I asked for. And so you had to be really specific with requests. It may take multiple iterations to get exactly what you needed. And that also caused bottlenecks because you only had one way to get that information instead of being able to get the information yourself. And then also, you know, what is the source of truth? What is the truth? Where are they pulling the information? Is this information correct? So there was a lot of negatives to getting information this way. And unfortunately, this is where many of us still are. So the next step with this is democratized data, a more matured business intelligence structure. So you can see over on the side, the data sources over to your left. We may have point of sale systems, payroll, QuickBooks, multitude of spreadsheets, data from our EMR. And then we can do this data analysis from that information, you know, financial reporting, engineering reports, HR reports, patient reports. And that's great because we can get the information when we need it. Bottlenecks are removed. Business analysts can get timely access and make decisions from their data much faster. But the negatives to this, you know, we have a security risk is increased because we don't have one source to pull the information from. You can get it from anywhere at any time. So we definitely have risk there. Scalability is difficult because everybody's kind of doing things on their own time and in their own terms. And so it's not easy to replicate something throughout an organization if we find it works really well in one area. Performance of systems are not optimized. So if we have people pulling big reports, it may crash our system. If we're pulling too much information at one time, we could slow everything down. And our EMR, when we're out with our patients, we want to make sure that that's working as we're there with the patient, especially in maybe in an emergent situation. We need that information right now. We don't want our systems to be crashing. Also, access to raw, dirty data permeates. You don't really know what the source of truth is. You don't know if that data is clean, and are we making accurate decisions based on inaccurate data. And then communication between the databases can be difficult because nothing is connected. And again, we don't really know what the source of truth is. This is where we want to be. Governed and trusted data management. This is our optimal business intelligence scenario. You can see it looks a little bit more complex. We're taking all those different data sources and putting them into a data lake, which I'll explain here next. And that data lake then has a data warehouse, pulling information from it, housing these accurate reports to do analytics in the different areas. So much more structured. We have a source of truth that's been established. Someone is monitoring this information and making sure that it's clean and correct and accurate data. We can have really good security measures in place. Scalability is very easy because we know where this information is coming from. Someone is owning this, and we can replicate this easily over time and over departments. The performance of the systems is preserved. No one can run a report that's going to take a drain right from the source system. The information is pulled from the source systems, finessed and cleaned, and then the reports are prepared from there. And then the availability of data is limited to only needed data. So you're not pulling reams and reams of information when you don't need it. You're only getting that information that you actually need to see at the time you need to see it. And then the accessibility is easy because the data is structured for the business analyst. So this information can easily be pulled, structured into whatever kind of reporting format or visualization is needed. Pretty much I'm going to make it sound way overly simplified, at the push of a button, because we all know that's not really the case. But considering where we came from to where we're going to be, it is pretty much closer to a push of a button versus having to have an individual report written every single time you need something. One of the negatives, though, is it can be expensive to implement a data enterprise solution. But at the end of the day, this is definitely where we want to be. Another con with this is with the cost can be mitigated by focusing on a few key business questions, though, and combining the data lake and the data warehouse into one step. So you don't need to put all of your systems into here right away, but really think about one of the main goals of your organization and what can you do to start this process on a smaller scale, get a hold of it, understand it, and then scale up over time as resources become more available. So like I said, I was going to explain the data lake. So the data lake is another one of those terms out there. These days, data lakes are becoming more data oceans because we have so much information. But information is housed in this repository called a data lake. All the information you can see from the different sites flows in here. It's unstructured. It allows all kinds of different analytics to be run, from dashboards to visualizations to big data processing and real-time analytics, depending on what kind of machine learning or tool you're using to pull this information out. So in a data lake, the data is stored as is. Again, there's no need to structure the data. So this means you can store all of your data without careful design or needing to know what questions you might need to answer for the future, like you would with a more structured database or a data warehouse. Different types of analytics on your data, like SQL queries, big data analytics, full text search, real-time analytics, and machine learning can be used to uncover insights. So this is where it all starts, is just really gathering that data into one place, understanding what you have, and then taking that information and going from there. With this too, we really want to think about how we want to aggregate our data and then visualize it. How do we want to represent the data? And I see a bunch of chats out here. Do I have? Nope. Okay. So all this information is great. but how do we make it useful? So this is a really crucial step in the process, since the accuracy of the insights from the data analysis depend heavily on the amount and quality of data used. So we really want to make sure that we're pulling out that high quality data, the accurate data that is going to answer those questions that we have. So data aggregation is that process where data is collected, presented, and summarized in a format for analysis. So it allows you to look beyond the two-dimensionality of like a row and a column like Excel, but really lets you take a deep dive into what that information means, where it's coming from, and start figuring out how to use the data from seeing the past to predicting the future. And then the data visualization is taking that summarized data, that aggregated data, and creating graphical representations like charts, graphs, maps. It really helps tell a story of, what kind of questions are we trying to answer, what kind of trends are we seeing, and whatnot, like, and the whys behind it. And the nice thing about data analytics, it removes the noise. It really highlights those things that we need to look at and puts those other things that really aren't as important in the background. And Nicole will go into that when she goes through the case study. It's really cool how you can use colors or shapes and different things to pull your eye to those important things that you really need to look at. And it allows for decision-making at greater speeds, precisions, consistency, and agility. So that's where we want to get to here. Excuse me. So what is data analytics? I know we hear so much about it, but how do data analytics relate to healthcare? And with this, I'm going to go through the 4 types of data analytics and relate them specifically to healthcare. I'm going to use hospital-acquired infections as my example, because we all know what those are. We've all dealt with them, and none of us want them to happen. So that'll be my example I go through here. So descriptive analytics are like, what happened? I look at this as kind of our traditional spreadsheets that we use, KPIs. So descriptive only tells you what happened. For example, like how many patients were admitted in July? How many patients acquired an infection while admitted? So it's basically giving us a picture of the past. It's the ability to quantify events and report them in human readable ways, helps with benchmarking against expectations or to identify areas of improvement on clinical measures or other aspects of care, which this is great. Sometimes this is all we need for information, and there's nothing wrong with it at all. And then another type of analytic is diagnostic. So why did this happen? It did happen, but why? So diagnostic analytics is a form of advanced analytics that examines data or content to answer the question, why? It's characterized by techniques such as drill downs, data discovery, data mining, and correlation. So really getting past that layer of a flat spreadsheet and digging into the numbers behind it or the information behind it to get us to that answer. So why did the patients get a hospital-acquired infection? This information should help us get us to the next step of understanding that. Excuse me. And with descriptive analytics, it involves a diagnostic of, as in descriptive analytics, diagnostic analytics involves an investigation of historical data. So we're still kind of in the past, and we want to start getting to the present and the future. So the next part of that is predictive analytics. What will happen? Not only what did happen and why did it happen, but what is going to happen in the future. So predictive is the ability to use descriptive data to forecast what might happen in the future. Predictive analytics is one of the hottest topics in healthcare at the moment, as providers seek evidence-based to reduce unnecessary costs, take advantage of value-based reimbursements that no longer reward voluminous care, and avoid penalties for failing to control chronic diseases or avoid adverse events like hospital-acquired infections. So, and these things are within their powers to prevent, but how do we do it? It requires access to real-time data that allows nimble decision-making clinically and financially. That demands something significantly more robust in infrastructure than just our EHRs that we have now. And then last but not least, prescriptive analytics. So not only what did happen, why did it happen, what or when will it happen again, but how did it happen? So That is what prescriptive analytics will do. The final phase of healthcare big data analytics involves obtaining these prescriptive insights. Prescriptive analytics moves beyond the ability to just predict an upcoming event and provide the capability to do something about it. For example, if an organization is experiencing an inordinately high number of hospital-acquired infections, a prescriptive analytics program would not just flag the anomaly and highlight which patients in the ICU may be next due to their vulnerable vitals, but it would automatically identify maybe a particular nurse involved in the care of these patients that are getting these hospital-acquired infections, spreading the infection around, and they might need to be retrained in appropriate hand hygiene processes. It may also help the hospital develop a more comprehensive antibiotic stewardship program to help prevent similar outbreaks in the future. So these are all the things that the prescriptive analytics may help us do. They also don't just predict what's likely to happen, but actively suggest how organizations can best take action to avoid or mitigate the negative circumstance altogether. So sounds pretty cool. And hopefully that is where we're getting in healthcare. I'm seeing more and more around this, but it does take a really robust system, you know, data analysts, data mining people, data experts on your team. So there is some cost to getting all of this implemented. So with these 4 levels of analytics, you know, this is kind of how we've seen them in the past. Descriptive, it takes less effort, but there's not as much value from it. And then all the way up to prescriptive, where there's a ton of value, but also a ton of effort. That's not necessarily the case. You know, we see them all pretty much at the same level. It just depends on your need at the time. It's all, you know, what you need may be descriptive, and that may get you exactly what you want. Therefore, it is high value. And same thing with the prescriptive analytics, the same thing there. So analytics and accounting and finance specifically. Here's a little quote from the Senior Director of the Public Sector Solutions Engineering at Tableau. Tableau is a visualization tool that can be used for analytics. So as we move into this new digital normal, there is an opportunity to think differently. Organizations are saying, let's not build our recovery on what existed before, but let's reimagine. So we're seeing a lot of thought process go into how we can automate things, how we can use analytics to help us work smarter and not harder. I just attended the HFMA event, and a lot of the presentations were exactly on this. So you can see that's where we're going in the healthcare world and beyond. Some of the major trends too that Gartner identified, 10 of the trends CFOs must understand to prepare for the future of finance. You can see 7 out of 10 of them are related to analytics, ERP, AI, RPA, all those new buzzwords that we're hearing in the industry. So, you know, it's not going away. It's only going to get more and more complex, and we're just going to have to get ourselves there. Here's some statistics for professional services. A BBC report stated 95% probability of an accountant or tax expert's job eventually becoming automated. 50% or fewer auditors will be hired by 2022 due to advancing technology. In the next 3 to 10 years, development of intelligent automating accounting systems will be the most impactful force shaping the industry. And 20 million jobs by 2024 will be professional and business services, is now estimated to be the 2nd largest employment sector in the United States. So you can see, you know, when I first got into technology, like Amy said, my degree is information systems, technology, and mathematics. There was very few people in my class. I think out of an entire graduating class at college, there was only 25 of us in this arena. I was the only female. You're definitely seeing that changing. Even if you go into something in college, it may not necessarily be technology related, but it seems like there's always a technology component related to it. So I feel like it's really important for us, even if it's not directly related to our jobs, it will most likely always be indirectly related in some way, shape, or form. So I am going to hand it over to Nicole for a case study. Nicole, do you want me to continue to control the slides for you? Or do you want to take over?
Nope, you can keep doing it. Our case, yeah, if you want to go to the challenges slide, thanks. So
Yep.
Our case study today is going to focus on denials management. But before I do that demo for you, I do want to talk about some challenges with data. Rochelle hit a lot of these points in her past slides, but I just want to recap a little bit and go into a little bit more detail on how it relates to internal audit. So some challenges that we all are probably used to seeing with data are inaccurate or inconsistent data, which can create risk. So if you think back to the data analytics pipeline, that first slide that Rochelle talked about, the traditional way, there's multiple different data sources, multiple different people pulling reports to try to get to the same data, and that can make it inconsistent. Also, something that applies to internal audit is the random sampling. So this is only examining a percentage of the data, and that holds the potential of completely missing an issue instead of looking at the whole set of data. Manual data processes, so these can also increase risk and be time consuming and inefficient. Rear view mirror versus looking forward. So historical reviews can be beneficial, but it does limit your real-time focus and resolution on issues in a timely manner. A lack of timely access, again, sort of like Rochelle talked about, we may be relying on IT or maybe another department or a vendor to run a report and send it over, so that could bog down your ability to do that continuous monitoring. A time to value, slow backend development. This leads to that slow backend development and resolving the root cause of an issue, and unscalable visualizations don't allow for that predictive or proactive approach. So I'm going to take control here and just do a quick demo for you guys. So this is a demo of a denial management tool, a viz tool or visualization tool. This is using Tableau. And I'm not going to get too in the weeds here, but I basically just want to show you the benefits of using a visual tool like this, and then show you how you can pinpoint those areas of opportunity or to easily find issues. So again, this is the denials management tool. We're using 835 EDI remittance data from insurance payers, and that's where this data is coming from. Depending on your role within your organization, denials might not be an area that you think about often or maybe pay much attention to, but they do help call out those pockets of areas that could need improvement or could be opportunity or could be potentially causing some areas of compliance or risk. So this first page here is sort of like an executive summary. Basically, it's telling you how many claims you've submitted and then how many of those claims are denied and what your denial rate is. There's some nice visuals here that can be very insightful, showing you by financial class. And just based on the case study that we're doing today, I do have this filtered to just preventable denials and then also just to the year of 2021. And you can see here, total charges denied monthly by financial class. This graph here really brings your eye to where you might have a problem. So to me, when I look at this, definitely in January, they were high. We started doing a little bit better, but something happened here in May. And then you can see that down here, denials by month. Below 2, you can see January, the denial rate was really high. Things got better. And then it looks like something happened in May. So throughout the rest of this demo, let's focus on May and see what we find. So hopping over, we're now looking at the denials by the financial class and by the payer. So again, another visual here where the coloring and the visual really helps draw your eye and show you where the pockets of problems are. So here again, if we're looking at May, we can see that Medicaid is really outstanding. And if we click on that, it shows us which payers under Medicaid have the most denials and could be causing the most issues here. So here, this would make me want to look into Prime West Health and see if there was something that happened in May with Prime West that would be causing all of these denials. And again, up here, this allows you to filter. So if you only wanted to look at a specific financial class or a specific month, location also we have as a filter on here. And if you had different areas, if you have some clinics or home health and hospice outside of your hospital, you could just look at those specific areas too. So that's nice. So then moving over to the department analysis. So this is showing the same thing, same data here, the 835 denials data, but now we're looking at it in a different way. So we're looking at it by revenue code category and by CPT code category. So basically this is sort of like your department, but because we have charges under both revenue codes and then some that don't have revenue codes and instead have CPT codes, we're looking at it both ways here. So the color is going to show you more denials by the count of denials and by the total charges denied. So that's nice because that really sticks out. Where are your denials based on color? And then again, when you click around, if we want to say, okay, what's going on in the OR, 12 claims denied, that doesn't seem like many, but it's over $100,000 just for that month. So you could easily just click on OR and it gives you more information. That one wasn't a great example, but let's say lab. You could come in and click on lab and it gives you your revenue codes here, how many claims denied and the charges. And then over here, if there was a CPT that was billed out, it shows you that too. And then sort of the same concept over here by CPT code category. If we wanted to look at that path lab and click on it, we can see here that this 80050, it's just a general health panel, but maybe we were billing those out incorrectly for that month or something because there are quite a few of them here standing out. And again, this can all be filtered. You could do by denial category. If you did just want to look at the maybe coding department or case management, you could easily just look at that one department and then see what denials are falling under for that month. This page is the denial distribution by the CARC and RARC code, so the reason for the denial. And again, I have this filtered by Medicaid for May and preventable denials, just sort of trying to find where those problems are. So most of it's falling under the coverage and benefits denials category. And it's super simple, just to click on that. It shows you the denial distribution by reason code here. And then if you click here, these 97s are sticking out. Sometimes those are preventable, sometimes not. And then this N390, the service cannot be billed separately. So maybe, you know, there's not a whole lot of opportunity in revenue here on this one, but it is an area that's, for whatever reason, a lot of denials are coming back. So maybe you are billing out some charges inappropriately together that shouldn't be, or something is missing. So it's definitely somewhere that you'd want to check out and look, because that is a lot of dollars denied in 1 month for this specific reason. And then lastly, we have this details page. And just for time, I have already filtered all of this, but again, I'm looking at May, Medicaid, and then I typed in my N390. So this is giving me a list of all those specific claims. And I would be able to easily then export this and give that to someone in a specific department or in billing and say, hey, can you check this out? What happened in the month of May with these claims? And is there something that we could have done prior to billing these out that could have prevented this from happening? And then just around denials and internal audit, you know, some things that stick out that you might find this helpful for are looking at denials in specific departments. So like we talked about, maybe coding or case management. It could be the lack of or missing information denials that you could find helpful to pinpoint those specific accounts and then look at those to see what is going wrong or what is missing. Missing ABN for lab services, missing or denied authorizations, that is a denial code. So you could pinpoint those accounts. And then also really high dollar denials. So, you know, there could be a claim that went out for a couple $100,000, and it would be very easy to pinpoint that using a tool like this and using analytics.
And Nicole, do you mind if I jump in for a second?
Yeah, go ahead.
You know, just as a real life example, in a previous life, I was a revenue integrity manager at a health system. And, you know, we were trying to do something like this, but we didn't have one of these tools. So we had to do everything with spreadsheets, and I was constantly running reports. But the thought is, it was really cool. I could drill down to figure out where I was seeing trends in the denials information. And like Nicole said, for internal audit, this is great because we can find compliance risks. So when I was doing this, I found, okay, we have an issue with our ABNs. Our lab department hasn't been getting ABNs for certain services. And then they weren't being billed correctly on top of that. So we had a risk there. And then case management with inpatient versus observation. We were finding we had denials there because patients weren't being put in the right status. And so all of this great information, this information is great for that because, like I said, I had to do it all by hand, and so many organizations are still doing this by hand, that it's nice to have a tool like this to really draw your eye to those areas that are going to be at risk without having to sort through a bunch of spreadsheet information.
Thanks, Rochelle. So with that, I'm going to stop sharing, and then I want to talk about some solutions that we showed through that demo. So solutions with data. So these correlate back to the challenges with data. So some solutions by using analytics or analytics tool would be decreasing risk with accurate data. So usually when you're using data analytics, you're using a tool that would be doing the data prep and different things for you using a computer and taking out that manual intervention or formulas that you would be doing in Excel. Specifically relating back to the denials management, the 835s are standard format remitted from the insurance payers to your organization. So there's really little to no manual intervention that happens there, and that alleviates the need for any like manual reporting or exporting of a work queue or anything like that that could potentially, miss some of those claims or denials versus just looking at all of the 835s. We talked about with the challenges of a random sampling. So using data analytics allows you to use the whole set of data and widens your scope instead of doing just that sample and percentage of the data. Weeding out inefficiencies. Again, time savings. There might be some more time spent on the front with analytics, but time savings on the back end. Also allows you to pinpoint potential issues quickly and then work to resolve those all at one time. So if there was a specific denial, you're not all over in the work queues, having somebody working the same denial throughout the day or throughout the weeks. You could just work them all at one time. Preventing future problems. So that would allow you to connect with different departments or a team and then fix the issue on the front end to prevent future denials. So like we saw with those N390s, if there was some way that the charge was set up or something that was happening in the front end that was causing that denial, you could go back and find that root cause and prevent those from happening in the future. Continuous monitoring and auditing. Using a tool like that and using data analytics isn't just like a one-time snapshot. It allows the analysis to be continuing. And specifically with the 835s and the denials, you could upload those into your tool daily if you wanted to, or weekly or monthly, and then allow you to update that and continually monitor those. So that's still the real-time and predictive analysis, same sort of thing, allows you to look at things real time and not going and reviewing denials maybe from 3 months ago, so you can catch those issues and fix them right away. And then overall, just having a proactive approach. So analyzing these data patterns offers more detailed analysis, assisting management and decision-making strategies, and increasing the efficiency of your overall business operations. So just before we wrap up today, I do want to provide some closing thoughts on how to get started with analytics. And I think Rochelle has some things to add here too, but to start, projects like this denials management tool can take a lot of effort on the front end, but they do result in long-term benefits that don't require much maintenance after that front end effort is being put in. Mainly because the 835s are industry standard format. So all of the data prep and getting that all set up so you can have the conversion and upload it into your tool, that would just be a one-time thing that's done. And then there's just a little bit of maintenance going forward, but it's worth all that front end to get the long-term results. We do understand that starting with something like this would be a big effort, and there would have to be, you know, a lot of development time and some expense put into something like a denials management tool. So maybe if you are new to using data analytics, you could pick more of like a pilot project and just start with something with lower complexity that still could have a high result, but just wouldn't feel like such a big hill to climb. And just to kind of get your feet wet, maybe just pick something that's a little bit lower in complexity. There are free tools available out there too, if you know, cost or budget is something on your mind that could be limiting you on this. So definitely look out there for some free tools. And then through your pilot project, you know, if you don't have a revenue integrity department or somebody that you've already identified as a business analyst, this could help pull that out and see who has the interest, who has the capabilities. Maybe somebody like Rochelle does have a background, they went to college for something like this and would be a good person to help spearhead data analytics projects in the future.
Yeah, definitely. Those are some good thoughts, Nicole. I like Nicole was saying, I feel like it's really important to start small and then work your way up, because like I said in earlier slides, there's just so much information out there. I call it analysis paralysis. There's so much data. I think organizations don't always know where to start, and they get overwhelmed, and like they just, everything kind of falls to the wayside because there is just too much. So look at your organization's goals and objectives for the next year, 2 years, you know, short-term and long-term goals. What are those that are most important or you're going to get the most value out of? Start with something like that first. Pick a specific area, focus on it, build your analytics up through that. You know, Nicole said it could be something very simple. There's plenty of free tools out there. There's a lot of free education materials. It's fairly, I feel it's fairly easy to learn, but again, that's my background. So I'm kind of a computer nerd. I like computers more than people. So this is what I like to do. So, you know, it doesn't have to be complicated. That's what, I guess, what we're trying to say at the end of the day. It doesn't have to be complicated. You don't have to build these huge, crazy systems where you put a ton of money into them. You know, especially in a smaller facility, you may not have a lot of resources in terms of people, time, technology, and dollars, but you can still do this. You can still do analytics. I like to use the crawl, walk, run approach. You know, start with something small, get your feet wet. Then as you get comfortable, start expanding that out a little bit more, scale it out to maybe more departments if it's something that can be used in multiple departments. I think a good example of this is charge capture. So many organizations don't really have a good understanding of, am I capturing all my charges for all the services I provided in a given day? Charge capture is a really good one for audit, internal audit and compliance, you know, making sure that we are capturing those charges accurately, we are capturing them compliantly. So maybe think about building an analytics tool around that. You could see, okay, on an average day, lab maybe does 500 lab tests a day. You know, you can trend this, and all of a sudden you see either a big spike or a big dip. And you could be like, oh, you know, what happened? Did something break in the interface, maybe from our LIS system to our billing system? Or did we just have a drop in patient volume that day? Did something break somewhere in our equipment? You know, so you can start as simple as something like that and then expand upon it as you get comfortable. Any other comments, Nicole, or thoughts?
I think you covered it.
All right. If anyone has any questions, feel free to put something in the chat or the Q&A. If there's anything out there, unless we did a perfect job of explaining it all. Everybody's just going to hit the ground running with analytics in their organization. Also, we have our contact information out here as well. Feel free to reach out to any of us with questions, thoughts, or anything regarding analytics in healthcare relating to internal audit, accounting, or anything like that. It's pretty much where Nicole and I live and breathe these days. And so we can definitely help you out and get you on the right path with that. All right, I don't see any questions coming in. Scott, do you have any final comments?
Thank you for the presentation. I just maybe reiterate what you said. I've done some presentations on data analytics, not just revenue cycle. And one of the common themes you hear, whether it's myself or others that present, keep it simple, get off the starting line, because that's always the challenge. I think all of you that are attending obviously are moving forward with it. I think you really have to. I think the future is really around this, because it's going to save you a lot of time. And we've done some things outside of revenue cycle that might be thought-provoking items, like Rochelle mentioned some of the anomalies that are out there. But if you're looking for unusual things, you can even get down to who's actually accessing and doing some of the billing process. Is there unusual items there? Is there unusual number of transactions, activities? I like what you mentioned, focus on a department first of all. And oftentimes through your risk assessment, you'll identify certain areas that may be of concern, or they're new or unique services. And this is where you can kind of take a smaller piece of the pie and start building out some analytics that can help you identify unusual things that are occurring there, or there aren't any, and it seems pretty straightforward. But instead of diving into a lot of detail testing, you can step back and try and identify those things that might be outside of the norm that's expected. So no, I think that's it. We will give you a few minutes back from your day, everyone, and appreciate everyone attending. And as Rochelle mentioned, our contact information is here, so we'd be happy to talk one-on-one with anyone that's trying to implement this stuff.
Thank you everyone for your time today. I really appreciate it.